Very good afternoon to you, ladies and gentlemen, members of the media present here at the Diplomatic Center, fellow citizens, wherever you might be, following us. Welcome to our usual and regular update on our COVID management responses. And today I would like to go straight into asking Dr. Parasram to give us his briefing and to take the health staff through our usual format.
Good afternoon. Thank you, Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. So we begin as usual with the COVID-19 update for August 27th, 2021. Number of tests done thus far, public and private, stand at 305,681. Over the last 24 hours, we would have reported 249 new cases, taking our total positive cases since March 12th to 43,999. Total recovered patients, 38,022. Total active cases now stand at 4,710, with 4,081 of those in self-isolation at home. Total in step-down, 101, and those in state quarantine at 180. There have been 1,267 deaths, and condolences to the families of all those persons who would have lost loved ones during this time. The Honourable Minister will go into details in terms of the vaccination rates, and Dr. Hines will begin with the epidemiological update.
Thank you, CMO. Honourable Prime Minister, Honourable Ministers, colleagues, members of the media, members of the viewing and listening public. The epidemiological update for data as at August 27th, 2021 is as follows. At that point in time, our epidemic curve looked basically like this. We have the colourful bars being January through August of the year 2021 over on the right-hand side. That indigo section, which is August, we see that basically the heights of those bars, meaning numbers of cases that we see from day to day, are just about the same height as those in July, some a little higher. So from July into August, we've seen a fairly steady number of cases, day on day and week on week, which is what we call a plateau. We have seen that sometimes that goes up a bit and sometimes it comes down a bit, but it really just sort of hovers around or within a range of a couple hundred per day over that last about 7-week period at this point in time. And that's better demonstrated by the rolling average, which is that dotted line that goes through the tops of the graph, of the bars on this graph. If you look at that same data aggregated on a weekly basis, you get a better picture of what we're describing in terms of that plateau, using the same colors of fuchsia for July and indigo for August. We see that those bars are, again, around the same height, and that means that week on week we've had approximately the same numbers of cases or similar numbers of cases, some increases, some decreases, between July and now. With the preliminary data coming in for today's testing, we would note that the total for this week will be just about the same, maybe about 3% higher than the total for last week, so still holding relatively steady. And we see that that salmon background portion really represents the changes in positivity, and it's been fluctuating between about 25 and 30% over that same 6 to 7 week period. On the monthly time scale, we see as we approach the end of August, the total figure is approaching that for July, but in the next 3 days, hopefully we won't actually get all the way up to 6,000. So we are looking at a small decrease between July and August. And we're seeing that that salmon section, again, looking at positivity on a monthly time scale, lies, as we said, between 25 and 30%. And the age and the sex distribution, what we call the demographic data, has basically held its pattern, with just about the same proportion of males to females, and just about 52% of the total being in that 25 to 49, or the young active adult age group. Whereas among the fatalities, we see that we have approximately 58% male, 42% female distribution at this point in time. Again, approximately 2/3 of those being over 60. We have noted that there have been comorbidities, meaning pre-existing or coexisting illnesses, be they diabetes, hypertension, kidney disease, etc., in the majority of the deaths, and as Dr. Trotman will go into in some more detail, sometimes people aren't aware of what comorbidities they have. So that's a thing to be aware of, or to be concerned about as you assess your own health and your own risk. And we note that the vaccination of persons with comorbidities reduces their risk of having fatal outcomes. Looking at the geographic distribution, we see the country divided into both counties and communities. And where we see the darker colors, that's where we have larger numbers in given communities, with some of these representing clusters that have been investigated. So some of the higher numbers, the darker colors, really relate to clusters that were investigated as part of small outbreaks in various settings. If we look at this at a county level, we see that the gold and the purple bars representing this week and last week's figures give us some idea of trend from one week to the next. So from week 32 to week 33, for most counties, we saw somewhat of a decrease in the totals for one week to the next. But for St. George Central and St. George East, we saw either a slight increase or just about a plateau. So again, mostly, hopefully, small decreases, but a couple of counties still holding numbers as opposed to decreasing. And when we look at that across a 5-week, or actually at this point an 8-week time span, we see that that last and the penultimate, the one just before the last bars, show this a little more easily for each county. And we see that most of the counties have been holding numbers. We haven't seen any big decreases. Most of the numbers are around the same, which again contributes to that overall plateau, similar numbers from one week to the next across all the counties. And with respect to projections and what we had expected, we still have the older projections from when we were moving at a much faster pace in April. That's the green projection. In May, that's the orange projection. We then began to have a slowing, and we were happy about that. The gray projection, which is a little harder to see, showed us actually projecting a downward trend. But at some point, that stopped. And instead of having a downward trend, we started to note that there was a small upward tendency, looking at the rate at which we were going from July, just about the second week in July, to the third. So we're looking at that, and using that projection, we've seen that red dotted line, our current projection. And while we're not quite reaching those numbers, we haven't fallen away very quickly from them either. So again, this again represents that plateau, but we're not exceeding the rate at which we had been going from July to this point in time. So that brings me to the end of the epidemiological update. I'm going to turn you over to Dr. Richards for the clinical update.
Thank you very much, Dr. Hines. Good afternoon to the Honourable Prime Minister, the Honourable Ministers of Health, Energy, and the Office of the Prime Minister, the medical team. Good afternoon to members of the media and the viewing and listening population of Trinidad and Tobago. Once again, thank you for this opportunity to present the status update on the 16 facilities in the parallel healthcare system as of 8 a.m. this morning, the 28th of August, 2021. Dr. Hines would have indicated that the rolling average, which is the average number of positive cases per day over the last 7 days, would have fluctuated between 159 and 170 cases per day. We also look at the number of net admissions, and that is the difference in admissions, which is the orange line, and discharges in the green line. For the last week, we would note that the gap between the admissions and discharges was quite narrow as compared to the previous 2 weeks. In fact, it is actually the narrowest it has been since the week of July 4th. And this can be interpreted as less patients or less additional patients being admitted into the parallel healthcare system for management and care. If we look at the actual breakdown of admissions and discharges per week, we would notice that there have been less admissions, which are the blue line, progressively noted over the last 3 weeks, while the number of discharges continues to be on or about the same or consistent. And if we look at this graph and look at the actual number of actual net admissions, meaning the additional number of patients or number of persons that are admitted into the parallel healthcare system, we would note that this number is significantly less as compared to the past 7 or 8 weeks. For the past week, there were 56 additional persons being admitted into the parallel healthcare system as compared to 127 on week 32 and 124 on week 33. And the last time that we noted a low number of net admissions as this was on or around the week of July 4th, where we would have had 49 net admissions. We also look at the actual number of COVID-positive patients hospitalized across the 16 facilities in the parallel healthcare system in Trinidad and Tobago. And as of 8 a.m. this morning, there were 394 patients hospitalized, with 292 across the 9 hospitals and 102 at the 7 step-down facilities. However, I'd like to pause and just emphasize that we've been noticing a trend of an increasing number of children being hospitalized and admitted for management of COVID-19. And as of this morning, there are 10 children in the parallel healthcare system who are being managed for COVID-19. Of these 10 children, 1 is receiving ICU level care, 1 is receiving high dependency unit level care, and 8 other children are currently receiving ward level care. And this is a trend that is causing great concern to all of us on the health team. And of course, you know, the Honourable Minister will speak to us about the role that vaccination will play in curbing this trend. The overall of the occupancy of the parallel healthcare system continues to be on or around 40%. Today, the occupancy is 38%, and this trend has been consistent since July 15th. If we were to break up or to disaggregate the occupancy in Trinidad versus Tobago, Trinidad this morning is at 38%, while Tobago is at 40%. And this can be interpreted as 4 out of 10 beds in either island in the parallel healthcare system is currently filled. We also look at the hospitals that are most resource intensive, that take care of our most ill patients in Trinidad and Tobago. And across Trinidad, we notice a similar trend where 6 out of the 7 hospitals in the parallel healthcare system continue to be under the 75% threshold. The only hospital above the 75% threshold is the Augustus Long Hospital, which is at 79% occupancy. With respect to the step-down facilities, 6 out of the 7 facilities are under the 75% threshold. It is only the area hospital Point Fortin that is currently above that 75% threshold. If we were to break up the levels of care and look at the occupancies, the wards are currently at 37% occupancy, meaning 4 out of 10 ward level beds are filled, while the ICU levels are 76%, and the high dependency unit at 34%. Again, a consistent trend that we've noticed since the 15th of July, and again, reiterating the severity of the COVID-19 virus, meaning that we continue to have a significant number of patients in the ICU and HDU. We look at the accident and emergency departments, which would be the first point of contact if a person is ill and confirmed COVID-19. And the accident and emergency departments continue to have low numbers of persons requiring transfers across to the parallel healthcare system, which is a good indicator at this point in time, but is one that may change and transform very quickly. The ambulance usage is another indicator that we look at, and at present, approximately 25% of the National Ambulance Service is used for COVID-19 transports, either from home or to the hospital or between facilities, with an average turnaround time from call to the ambulance being returned to base of 120 minutes. Ladies and gentlemen, I provided you with a brief snapshot of the situation in the 16 facilities or institutions in our parallel healthcare system. The Ministry of Health continues to do all in our part to save lives. We continue to maintain a consistent occupancy trend of 40% for the past 6 weeks. However, we must be aware and we must note that there are several trends that are very concerning, one of which would be the increasing number of children that are being hospitalized for COVID-19. Another trend that remains consistent would be the high occupancy levels of patients requiring intensive care treatment and high dependency unit treatment. We appreciate and acknowledge and thank you for your support in following the 3 Ws and the public health regulations. But in order to keep the occupancy in our hospitals low and to minimize the risk of death and serious illness, we would like to appeal to you to please ensure that you are vaccinated and fully vaccinated in that regard. Thank you once again, Prime Minister, for this opportunity, and I hand over to you.
Thank you very much, Dr. Richards and Dr. Parasham, Dr. Hines. Could we have at this stage the Minister who will brief us on the vaccination program?
Thank you, Honourable Prime Minister. Good afternoon to Minister Stuart Young, Chief Medical Officer and members of the medical team, ladies and gentlemen of the media, good afternoon. To viewing and listening public wherever you are, good Saturday afternoon. So it's my duty once again to bring you up to date on the vaccination program. Could we have the first slide up, please? And there it is. So, to date, under the first dose regime, under the second vaccines that have to be administered with 2 shots, those first doses, 503,239, broken down by RHAs, Northwest, 66,248, North Central, 87,904, ERHA, 51,946, Southwest, 115,278, TRHA, 16,014, state agencies, 26,143, other agencies, which are primarily our public-private partners, 139,680. Total second doses to date, 389,317. And now that we have in the mix, for the first time starting last week, a single-shot vaccine, total administered to date, 1,063. Now, you may remember we did indicate that we will be starting with our coastal areas, remote areas of interest. And the Southwest, they would have done the lion's share, almost about 60%, 598. So that would have covered significant portions of the southwestern peninsula, Cedros, Icarcus, Point Fortin, and so on. And they are continuing this weekend, so that's good. On the northwest, they would have done areas like Arepo. I think they are going into Blanchisseuse, so that's good again. Northwest would have gone into Las Cuevas and so on. North Central, 82. They would have gone into Arepo and so on. They would have done about 82. Eastern, they would have made a sweep in the northeastern peninsula. Matlot, Sanssouci, and so on, 215. So what that means is that communities that before those coastal communities, rural communities, for whatever reason, we are now reaching them. TRHA, a bit concerning there, 35. So we really need to step up in Tobago. If you could go to the graph, please. So this is how it looks graphically. The green line shows you 503,239. And the aquamarine line, 389,317. What this means is that 36% of the population have now received their first dose of a 2-dose regime, 36% of the population. And 28% of the population have received either 2 shots of a 2-dose regime, or now they are 1 shot and done regime, which is the Johnson & Johnson vaccine. What is a bit concerning, and we will talk about strategies to address this now. What is a bit concerning, you will see that both lines are starting to veer off of that vertical trajectory, which means there's a slowing down. So we want to accelerate and get those lines going, but a little more vertically, which means we are vaccinating more people in a shorter time frame. Before I tell you what we'll be doing to address that, you may recall we started our vaccination and pregnancy program last week, Wednesday. To date, 86 pregnant women have taken advantage of that program. So it means that 86 women are on their way using the Pfizer vaccine approved for pregnant women, are on the way to being fully vaccinated and will not bear the brunt of COVID-19 in a few weeks after they get their second dose, and then 2 weeks after for full immunity to develop. So we encourage all pregnant women to make use of the Pfizer vaccine. Now, the question has been coming, how do women in the private sector access the vaccine? So let's just give you a breakdown. We have roughly about 17,000 live births per year in Trinidad and Tobago. 92 to 93% of live births take place in the public sector. So you could work that out. So we are starting, have started under Dr. Adesh Surgising, a very robust education camp in our antenatal clinics, where we hope to cover 93% of our pregnant population. The other 7 to 8% will be covered by the private sector. Dr. Surgising is already working closely with all the private sector OBGYNs to inform their patients that they could access the Pfizer vaccine in the mass vaccination sites. So that is where we are with the vaccination and pregnancy. I want to turn a little bit now to the Johnson & Johnson vaccines. 1,063 have been given out. It's a good start. It means many people are, in 2 weeks, will be fully vaccinated after receiving one shot. Many MPs, and I want to congratulate MPs across the political divide, because this is non-political. We reached out to all MPs, PNM, UNC, whatever. I really want to congratulate MPs like Camille Robinson-Regis, Marvin Gonzalez, Dr. Lakram Bodo, Dr. Rai Ragbir. They have really taken this program and are really doing wonderful work in their constituencies. Many others are. MP Keith Scotland will be doing some work in Sealots today. Other MP Kennedy Richards is doing wonderful work down on the Southwestern Peninsula. And we are reaching out to all MPs. We are going to be expanding the Johnson & Johnson drive, one shot and done. From next week, late next week, it will be made available at all health centers, all 109 health centers throughout the length and breadth of Trinidad and Tobago. We are going to continue focusing our outreach activities to those communities that need the information and that need this easy access, and our mobile units will be going. Yesterday, in my capacity of the Member of Parliament for St. Joseph, we did an outreach in Bangladesh, as I promised last week. The figures were decent. We did about 39, but many people were already vaccinated through the CPEP program, vaccination drive and construction. But it means 39 more people in a close-knit community where people live closely together are now protected. And those are good numbers. We'll be doing, in addition to our outreaches and mobile units, pop-ups, construction sites. You have a big construction site, we are going to pop up there, vaccinate you. Malls, groceries, and public spaces, markets, to try to get these 106,000 doses into people's arms as fast as possible. So hopefully that will take the aquamarine line a little more vertical instead of plateauing. I want to turn attention now to the expanded reach of the Pfizer vaccines. The Pfizer vaccines was a gift from the United States government, for which we are thankful. and thanks to the Charge d'Affaires, Mr. Shanti Moore, Minister of Foreign and CARICOM Affairs, and the Honorable Prime Minister who led the charge. We received 305,370 doses. Now, I want the public to understand where we are coming from. These doses expire on November 2021. So it means we have a relatively short time frame to use out these doses. It's a 2-dose regime, so it means that shots have to be given 3 to 4 weeks apart. It means, therefore, we have to use out half of those shots by the mid-October to end of October latest. I want parents to pay attention to this because these doses were initially ring-fenced for children 12 to 18. Now, what we have noticed, of the 22,330 12 to 18 vaccinated, even if you take out the 35 migrants from that, it still means 25% of our eligible school-age population has been vaccinated. But what is concerning is that the initial rate per day of 3,000 to 3,005 is now down to under 1,000. We will continue to prioritize our children. However, we are now going to open up Pfizer because the doses can't waste. They are expiring in November. We will continue to prioritize children. That's our first priority. But we are now going to open it up to all healthcare workers, give them another option, and teachers. We see how that goes before we open it up to the general public. But the caution here is parents of children, get your children 12 to 18 vaccinated, do not delay, because these doses cannot last forever, because they have an expiry date of November, and because it's a 2-shot regime. We have to finish off half of that by mid to late October for the latest. Please, parents, get your children vaccinated as we open up Pfizer to other at-risk populations. Healthcare workers, we are giving you another option. And teachers, we are giving you another option. We see how this goes before we make further decisions to open up Pfizer to other sectors of the population. So that's where we are with our vaccination numbers. Our numbers, we have been consistently saying, whilst not ideal, we are about 5 to 10% off pace. By now, we should have had about 525 to 550,000 persons with their first dose, but we are at 503,239. It's a decent place to be, but we could do better. We are continuing our education drive in the public domain. We have done significant radio work this weekend. We have launched a new series of press ads this morning, which have gone down very well based on the feedback I have gotten, where we are asking people don't delay. Because a lot of vaccine hesitation is not about not wanting to be vaccinated, but people are waiting for the appropriate time, whatever they see the appropriate time is. However, the time to get vaccinated is not 2 weeks from now, when Dr. Hines comes back and says the Delta variant is in the country and people start to panic. The best time to get vaccinated is now. Don't delay. Thank you very much, Prime Minister.
Thank you very much, Minister Dayal Singh. I think at this stage I'd like to ask Dr. Trotman to give us her perspective from the clinical experience standpoint, both from what is being seen locally and, I dare say, internationally.
Honorable Prime Minister, Ministers, Dr. Pasram, CMO, members of the medical team, members of the health giving population, all involved, members of the media, members of the listening and viewing public. It is my pleasure today to stand before you in a country that is embracing the vaccines that have been put forward to them, but to also put into perspective the patients that we are seeing that are coming within the hospital. For the most part, the patients that are coming to the hospital are unfortunately sicker and unvaccinated. We are seeing patients in the emergency room who we are able to treat and send home. But there are some patients who are presenting quite ill, and more than 95% of them, especially when they are in the ICU and HDU, are unvaccinated. The clinical presentation of these patients are more elderly, over age 60, and those who have underlying medical problems that we call comorbidities. Unfortunately, some of these patients are not even aware that they have comorbidities. So they feel that they are well until they present themselves to us. And it is when we start the investigation that we realize that there are underlying comorbidities that these patients were not aware of. And it's something I wanted to bring to the attention of the public so that you can start looking at yourself and your health. That I'm not going to the doctor, so I feel I'm okay, but you may not be. So it is important that you do your primary health care checks to ensure that you are okay. And it is even more important that you are vaccinated. I want to also speak to one of the comorbidities that we are seeing that people don't always look at as a comorbidity, and that is obesity. When people's body mass indexes are above a certain amount, we call that being obese. And that has also been playing a major factor in the way that patients are presenting. What we are seeing across the world at this time, in many countries, as we all know, is the surge of that Delta variant that has proven to be a form of the virus that can spread very rapidly. And we know that vaccinations can help curb that spread and also decrease the severity of illness when it presents itself. So as always, we are pleading to the nation, all of the age groups having vaccines to be offered from age 12 and up, and to other at-risk populations, including pregnant females, that we avail ourselves of this vaccine. It is for us on a personal level and on a national level, for our country and for where we can go. Remember that even as we are vaccinated, we continue our public health measures. Wash our hands, wear a mask, watch your distance, and please vaccinate, vaccinate, vaccinate. Thank you.
Thank you very much, Dr. Trotman. Ladies and gentlemen, members of the national community, wherever you might be at this time, I would like to take you back to our updates, press conferences, conversations in end of May, early June, where from this podium I outlined a pathway to a possible position, best case for us in September. I told you then that we were working very hard towards being in a position to vaccinate end of July and more so into the first part of end of June into first part of July. And at the time, given the resources we had available to us, I told you that we would have pretty much used up what we had in early July. There more than likely would have been a week or two when we would not have had any vaccines in hand to keep the program going, but we would have been poised to do that as soon as we get shipments that were due towards the end of July and into early August. And that did happen. But even at that time, I told you that during August is the time when we should be vaccinating. And that was under the expectation that we would have got vaccines to be very aggressively vaccinating in August, and that would have put us in a good position in September to talk about school children coming out. Well, July has come and gone. We did have that little break in July when we had pretty much run out of doses in hand, but thankfully the shipments came in, and you had the good news of the variety. We have a variety. We have a large number of vaccines. So July has come and gone. So we are on track. Tuesday will be the end of August. We're not on track. And the reason for not being on track is because during August, when we had the vaccines in hand, we have not been able to get the population to accept those vaccines in any great hurry. Interestingly enough, the only time that we really had the kind of response that we expected in a pandemic was that singular day when we had no vaccines for all who came out. And of course, you know, that was a mini carnival. It took us 2 weeks of discussion about that. But if that enthusiasm, even a significant portion of it, had been expressed during August when the vaccines were available, today I could have been talking to a different population in a different conversation. The minister, in his adjectival descriptions, spoke to you about the glass being half full. It is for me to speak to you about the glass being half empty. We have vaccines for those who want to be vaccinated. We have enough in hand now to keep us busy for as much as you can come. And if we run out of that, we have access to more. The bottom line is, today we can only report that 36% of the population has got its first dose. And because those are largely two-dose vaccines, 36% is not vaccinated. It's being vaccinated. So getting your first dose is only a part of the process. 25% of the school children for whom we made special arrangements and for whom we expect for their activity to be in a special situation, 75% of the students who could be vaccinated and then be taken out to school in cautious portions are not now vaccinated. And it appears as though, given the initial enthusiasm to get vaccinated at the opening of the program for the children, it appears as though the conversation against them being vaccinated has now morphed into one of defending their rights to not be vaccinated. Whatever that conversation is, the final sentence in it is that 75% of the children who can be protected by vaccination are not today protected. And it is not because we don't have the vaccines, and it's not because we have not been appealing and imploring parents to do that for more reasons than one. And the same thing applies to the national population. The minister talks about wonderful, and he encourages with encouraging words. What's the bottom line? The bottom line is that we have 800,000 people in this country who can be vaccinated, but who are not. So the figure of 500,000 sounds like a lot that we have done, and we have done a lot. And we can congratulate all those who have taken part in getting 500,000 people in this country getting their first dose, and a significant portion of the second dose. That's the situation. But when we look at the glass being half empty, we have 800,000 people, of whom half of them are required to be vaccinated, to bring that figure to 900,000 of the 1.4 million of us. And only then can we say that the vaccination program is in fact successful and is expected to be clinically useful, as it can be given what we know of the virus and its behavior and the human response. And so when you hear about 1,000 people taking the Johnson & Johnson one-dose vaccine, it doesn't matter what the minister's adjective is. We have 108,000 of those vaccines in this country. And after it's been made available with all the anxiety and all the exhortation and all the expectation that if we get vaccines in this country, we will vaccinate ourselves under the reasonable arguments of the scientists and the doctors, that we'll vaccinate ourselves so as to be better off than being unvaccinated. And we're being told that only over 1,000 people. Tobago, 5 people?
20. 35.
35 people? Yeah, well, you know, that is not what we expected when we spoke. That is not what we expected when we spoke in June. That is not what we expected when we spoke in July. That is not what we expected August to be. And the September of children coming out to school to mix with a vaccinated population, this is not what we expected. We should have expected, and had good reason to expect, that once we got our hands on vaccines during the month of August, we would have been vaccinated to a point where the report would have been more promising than it is now. Ladies and gentlemen, what can I say? This program is still a program of voluntary response and a program of holding the government accountable to get you the material to make that decision. That's what it is, and that's how it remains. I just want to point out to you that we are not in the forefront of this, fortunately. There are a lot of people who are in the forefront of fighting the COVID-19. You can look to the countries of Asia. You can look to the countries of Australasia. You can look to the countries in Europe, and nearer home, you can look to the United States or to South America. In the United States, they have a tremendous capacity for collecting and broadcasting data in minutiae. And because of the structure of that country, their data is collected by states. If you look at the state of Mississippi, which is one of the least vaccinated in America, their level of vaccination is at 36%. And that is not first dose. It's 36% vaccinated. But because of the lack of vaccination for the rest of the population, they are experiencing huge negative responses, meaning collapse of the health system because not enough people are fully vaccinated. So if in that situation where they are fully vaccinated up to 36%, and their health system cannot cope with the spread of the virus among the unvaccinated. What then can we expect in Trinidad and Tobago, where our 36% is the first dose level, and of course the 28% is the second dose? So compare Mississippi with at 36%, and we are 28%. Can we expect to perform better than that population? The only inference we can draw from that situation is that we are exposed. We are very exposed. We are dangerously exposed. But we can do something about it by improving the level of vaccination of the country. That is the long and short of the story. And it's on that basis that I'm saying to the Minister of Health, and he's saying to his team, we will continue to provide all the information available to us, to the population, to allow them to make a decision towards the requirement to get vaccinated and be a part of the vaccinated population as against being a nation that is largely unvaccinated. So 800,000 people to go, we'll be happy when half of that is vaccinated. Only half. Because in the other half, you'll have young children for whom there's no clearance to vaccinate them with any of the vaccines that are available. Under age 12, there's no clearance to vaccinate them, so put them aside. And there will be a certain number of people who may even want to be vaccinated, but they do have good reasons not to be, largely because of medical and other considerations. But the other people, we will still be exhorting you to get vaccinated so that the population of Trinidad and Tobago can, rather than be worse, in a worse position than a state that is 36% vaccinated and still in trouble, we could probably end up like the United Kingdom, which is heavily vaccinated. The virus is raging in the population, but not throwing people down, and the level of hospitalizations and deaths are minimal. Because it is clear that the defense of the human population at this time is vaccination. How else can we put it? How else can I put it? All the information from around the world is showing that the vaccinated population is the group that is doing better. So if you're not going to get vaccinated, it is because you are choosing to be in the group that is doing worse for reasons best known to you. And that is what our position is as of today. We are also exposed to the possibility of other variants. And the longer a population remains unvaccinated, the greater the possibility of that population itself triggering a mutant that could be of interest to us. So we leave that on the table. We are also nervous about the fact that so far we have caught a handful of Delta carrying persons who we were able to catch in the quarantine and isolate. For how long we'll be 100% successful in doing that, we don't know, but we keep hardening our border in that way, quarantining, testing, and discovering. But we cannot honestly say that there's no way the Delta virus would get among us. What we can say is that if it gets among us and meets us heavily unvaccinated, then we could end up in an unnecessary crisis. I would like to be, the minister would like to be, the health department in all its manifestations in the country would like to be in a position where if and when the Delta virus enters our country, it meets a population that is largely vaccinated. So the numbers again, 28% vaccinated fully, meaning vaccinated, and that leaves us, right, with 72% of the population. And if we take a figure of that as to who really should get vaccinated, we're looking at an additional 400,000. How soon the health department can get those 400,000 people, or most of that 400,000, to become vaccinated is a matter that is entirely for us to find out based on the response. Let me get back to the children at school. We are offering, unless, of course, calamity intervenes in the next cycle. We are on these 14-day cycles. If in the next 14 days, next 28 days, no calamity intervenes, we will continue to be keeping our economy and our daily social contacts throttling at the level at which it is now. And you will have seen that while our numbers have not gone down, they have not gone up alarmingly. But we would love for it to go down. But in the meantime, we are in fact being very active, much more active than the statisticians would like us to be, because that is what's going to change those numbers. But we're living with the virus. And if there's no significant change from that, we will offer face-to-face classes to our children in Form 4, Form 5, and Form 6 in all our private and all our secondary schools. But that option is going to be offered to vaccinated children only. And those children who are not vaccinated will get their education at this time by an alternative means, which the Ministry of Education will outline in the near future. It means that we are asking that those children be vaccinated fully, meaning first dose, second dose, and 2 weeks to develop their immunity. And today I'm asking that we offer these children face-to-face education with the relevant teaching and teachers from the 1st of October. So we'll finish the vaccination program of children during September. So whereas before we thought we could do it in the middle of September, when I spoke in June, seeing what has happened now in August, we are now in a better position to say where we think our point of safety would be. We will give the rest of September to get that vaccination done, and the 2 week. So if children are to get that 2 week immunity building and a full vaccination, the 2 dose, it means that they will have to be vaccinated by the middle of September. So by September 14th, all the children who are authorized by their parents to participate in face-to-face learning should have been vaccinated. It means that this figure of 25% should rise considerably between now and the 14th of September. And the other children who have not been positioned for that, arrangements will be made. The school term starts. Remember, the school term starts virtually for everybody. The school term starts virtually for everybody on the 6th of September. So schools are going to start on September 6th. But for those who are vaccinated, there'll be the option for face-to-face classes because they are in that condition. I just want to say one thing here without going into too much detail, and I'm speaking here to parents and guardians. Online lessons do not a substitute for education make. It is largely private business, for profit, and I am cautioning parents that this is not a substitute to your children going to school. In fact, the government will be monitoring this situation very closely and will take appropriate steps as required to ensure that the pandemic does not establish new policies to the detriment of parents and children. We continue to cautiously remove our restrictions. We are currently evaluating the effect of the last restrictions that we removed, which are the restrictions on the retail trade, where large numbers of people have been allowed to continue their daily lives in the retail trade. From all reports, there is a lot of room still for people to get involved and are getting involved. And Dr. Hines and his team, they are looking at this very closely, but we wouldn't get a clear figure as to the outcome of that removal of that restriction until another week, which would be the end of the 14-day cycle, to see what effect that had on the population's infection instances. And I would say today, if at the end of that week, when we finish assessing the retail trade coming out, we are still in the same or similar kind of situation that we are in today, when we do that next week, we are hoping then to be able to give some relief to the national population with respect to the participation in religious and other ecclesiastical services. So we are hoping, in short, to open back up church services at churches and other mosques and mandis and wherever you worship, with some restriction of numbers, more than likely, but hopefully by the end of next week, we should be able to give you that information, that we are in a position to go back to our worship by about the 6th of September, which is 1 week from today, thereabouts. So that being it, all we can say is that we are exhorting the Minister of Health and his team to get the vaccines out to the people who will agree to have them. And I do know that you have the intention to work with the Minister of Education on going to the schools. Could you say something about that, please?
Yeah. Thank you. Thank you, Honorable Prime Minister. So, phase 1 of the school children vaccination program was at mass vaccination sites throughout the length and breadth of Trinidad and Tobago. Phase 2 now, we are working with the Ministry of Education and my colleague to have, on a rolling basis in the 7 education districts, I believe there are, that we say, I'm just calling a schooler, let's say St. Augustine Girls. You bring the whole student body who is not vaccinated to St. Augustine Girls. You vaccinate them. Hillview. I can't forget St. Mary's College as an old boy. And if I don't say prayers in San Fernando, Faris will kill me. But that is what we are going to do. We are going to start to roll it out to specific schools and have the school population come in on a specific day to get vaccinated, all in an effort to decrease and eliminate any barriers, physical or otherwise, to vaccination, so that the Honorable Prime Minister's objective of having face-to-face classes with as much students who are fully vaccinated can be fulfilled. Thank you very much.
Thank you, Minister. Having said what I've just said about the religious bodies, today I want to appeal to the leaders of all of these bodies, the leaders of all of these churches, leaders of all of these mosques and mandis, wherever you are. You are the leader of a group of people somewhere in this country. I'm appealing to you to use that leadership in support of the science that told us and tells us that if you are vaccinated, you are safer, and encourage your congregation, your devotees, encourage them to get vaccinated as quickly as possible before you take up the opportunity of going back into your normal services. That would go a long, long, long way in helping us to catch up in the August numbers that we are now saying had not met or have not met the expectations. But if these leaders who lead small, medium, and large groups of people, and in fact people who listen to them for guidance on matters which they do not rely on the politicians for, if you are in a position to so influence your flock, you will be doing the nation an additional service by getting them vaccinated, because every vaccinated person is a strength in Trinidad and Tobago in this fight. And we are saying that once we see things not worsening, we will go back to our churches and go back to all our places of worship. If you have any questions, we'll take them now.
Good afternoon, Prime Minister.
Richard, there was a hand up in the air before. I know you couldn't see your colleague behind you, but she was way ahead of you. Yes?
Terry Ann Brown Campbell, TTT News. Prime Minister, is Cabinet giving any consideration to mandatory vaccination for certain essential groups such as nurses, teachers, police officers?
We are not doing anything that we have not said we are doing. Everything that we are doing, we've said to you. So don't look under any stone or behind any wall for any ulterior position. I have been entirely open with this population from day one. We are relying on the good sense of the population. When we have disappointment, as we have today, that August was not what we expected it to be, we tell you. We have left the essential people to vaccinate themselves for their own protection. We are encouraging them so to do. The minister said this morning that we are making additional options available to the healthcare workers who we believe their level of vaccination is still too low. The teachers who are going to come out to teach, long ago in the program of vaccination, we made special arrangements for teachers, not once but repeatedly. So we expect that teachers, more than anybody else in this country, would be in a position to explain the science to other people. And of course to have themselves in a position not to be a problem for their society and their charges. So as of now, we have no other position than what we have made public, but we have also said, if those positions are not nationally satisfying, then the government will intervene as we see needed.
All right, Rashad Khan from Guardian Media again. Thank you, Prime Minister. So I just want a clarification on one of the points you would have made there just now when you spoke to the reopening of school for vaccinated students. Now, you referred to it as being an option, but later down you said that online schooling is not a substitute. So is it that parents won't have a choice if they want to send their children to school, even if they are vaccinated?
I don't understand your question.
Okay. Some parents have stated that they like the online platform.
That's not a question. We're not discussing what the parents are saying. We're saying to the parents, if the child is vaccinated, an option that is available to that child is face-to-face learning. Remember, school is starting on the 6th of September. All children are back at school, virtual. But if the child in Form 4, Form 5, or Form 6 is vaccinated, the option to have face-to-face learning is available. If you want the child to have face-to-face learning without being vaccinated, then that is a problem for the parent.
Okay, I'm just clarifying, right? So then, would the converse be true? That a parent whose child is vaccinated and they have that option of face-to-face learning but would rather not send the child to school, can they allow their child to stay home and attend virtual classes?
I thought that's what I said. I thought that's what I said. School starts on the 6th of September for all students. So if we don't open up face-to-face, all students will be having their school away from the schoolhouse. Okay? We are saying that in order to have face-to-face teaching, and for the older students, those students would be required to be vaccinated so they can come to the schoolhouse for face-to-face teaching. So the child can't be in two places at once. So those children who are not vaccinated will have the option to have their education through the virtual system, which is the one that they're using on September 6th. But on the 1st of October, face-to-face learning would be available. Face-to-face contact will be available. But to access that, it has to be for vaccinated students. So that means the student can continue what they were doing from September 6th, going right through the term on virtual. But there are other parents and other students who choose, instead of doing virtual, which is available, they come for face-to-face teaching at the schoolhouse. Because to be at the schoolhouse, that population of gathering at the schoolhouse, for health and safety purposes, they have to be vaccinated.
And how would that work, though? Would there be separate teachers to teach the virtual classes?
That is for the Ministry of Education to work out, and that is what the assignment is going to be, to make it work. So that is what has to be, to preserve the option of choosing not to do it. Right?
We have just a tad bit more details regarding the 10 children.
I'm not clear. Wait, talking to the minister?
Oh, yeah, sorry.
Speak a little more loudly, please.
Speaking to the minister regarding the 10, actually to Ms. Richards, about the 10 children who are hospitalized with COVID-19. So we get more, just a few more details, perhaps maybe around ages, areas, anything that, more details that we might have from you.
Okay, thank you, Terry-Ann. Of course, we do follow the medical ethics in terms of confidentiality with regards to the release of patient information. We can confirm that there are 10 children, and of course we would know what our legal definition of children would be in terms of ages, who are presently in the parallel healthcare system. And as I indicated earlier, they are receiving different levels of care. 8 out of the 10 children are requiring ward level care, while 1 child requires high dependency unit level care, and 1 child requires intensive care unit level care. Thank you.
Can I get a total number, like since the beginning of the pandemic, how many children have had COVID or been in hospital or have had even, because I've heard in a newspaper report that there was a second case of reaction to Pfizer in a child. So I don't know if that was true, but I would like to confirm, please.
This is in terms of the number of children who have been hospitalized with COVID?
Hospitalized?
With COVID as well as the vaccine related?
No, hospitalized with COVID, the total number who have had COVID, and if possible, if any, there were any other cases of reactions to Pfizer.
Well, that information is information that we would have to confirm and to provide with you, that we have to get out of our different epidemiology and public health observatory departments. So I don't have it immediately on hand, but of course you are free to communicate with the corporate communications department, and we would provide it. Thank you.
Dr. Richards, since you're up there, I asked it last time when we spoke about children. I'm just asking again. Given what we know about the Delta variant and its propensity to infect children, has any samples been taken from them and sent off to UE? And is that standard operating procedure at this point for children being infected?
Yes, all children that are confirmed as positive and are in the hospitals do undergo genomic sequencing, and it is sent to the UE lab, which of course is working in conjunction with the Ministry of Health and the Trinidad Public Health Laboratory. And that's a standard procedure. Thanks.
Minister, could I put a question to you, please? It's on the issue there that Dr. Richards would have raised about patient confidentiality. Now, I mean, asking for demographics like age. We're not asking for the children's names, where they live, those kind of things. We're just asking for the ages. And seeing as when Dr. Hines presents all his data, we get age ranges. So, I mean, just if you could clarify for me, why can't we get the ages of the children that are there right now?
So as Dr. Richards says, and Dr. Hines said, you get age ranges. We have to be very careful with children and patient confidentiality. And we give you the range, 18 and under, because the definition of a child is anybody under 18. So those 10 cases is 10 cases are all under 18.
Is it possible we could at least get from the youngest age to the oldest age in there?
That is not the policy of the Ministry of Health to protect the remember, these are families that are going through a tremendously hard time. And because you are dealing with a very small population of 10 persons, when you give an age out, you know, it's very easy to figure out who is this person. These families live in communities. So to protect the patient, what is relevant to the country, and this is something we all grapple with, the right to know and protecting patient confidentiality. We come before you and we tell you honestly that we have 10 children, and by the definition, persons under 18, we tell you their level of care. 8 are in ward, 1 is in HCU, 1 is in ICU. That is about as much information we could share without breaching patient confidentiality and putting the parents through a torturous time. Thank you very much.
We have Pfizer, Minister. Pfizer is expiring in November, you said, and I think you sent out something about Canada, the AstraZeneca from Canada, about 31,000 of them expiring soon as well. What is happening with Sinopharm? How many do we still have, and when is it expiring?
Oh, so thanks. So the Sinopharm batch has a very long expiry date, just like Johnson & Johnson, 2023. So as far as those two vaccines are concerned, we're in a good place. However, a vaccine is only useful if it's in your arm, not on a shelf, in a chiller, in Cuba or wherever. We need to get vaccines into arm regardless of their expiry date. But as I did indicate, the issue with Pfizer is of particular concern now because they expire in November. We have to use out half of it by mid-October, and then we reserve the other half for second doses. So anybody who doesn't get vaccinated in that 150,000 before the middle of October cannot access a Pfizer shot after that. So assuming we use all 150,000 by the middle of October, no one after that date can get a full shot because we have to ring fence, as we have always done, for the second shots.
So we have to find ourselves throwing away these vaccines or giving away?
We are doing that so we don't have to throw away vaccines.
What happens in the instance that we end up with them on our hands? We just open the categories up more, or what is the plan?
So when I was speaking, I was very careful to say that in the first instance, we are ring fencing for children. We are now expanding to healthcare workers and teachers, and I did say we will look at it and then see how we release it to the general population, because we don't want the doses to waste, but we are giving parents a little more time to make an urgent decision to get your children vaccinated. But we can't hold these doses for you indefinitely. There will be a cutoff. And we look at it week by week. So this week we opened up to healthcare workers and teachers. We will see what happens next week and so on. Okay?
People are also wondering about if there will be any changes with the curfew allowing businesses to operate and so forth at a later point in time.
No, we have not taken any decision to change the 9 to 5. A 9 to 5 curfew means that you start winding down in such a way that by 9 o'clock you are not outside. That is because of the purpose of the curfew. I explained this at length before. If you have an 11 o'clock curfew or 12 o'clock curfew, you're not affecting anything. As a matter of fact, you will be encouraging some significant activity between 5 o'clock, assuming that people are at work, and by 5 o'clock they're away from work. Between 5 and 11, that is when a significant amount of non-essential activity can take place. Even a simple activity like visiting, inter-family, inter-house visiting, that kind of activity will take place during that time. And that is where the exposure is. And we are trying to reduce the exposure. Because remember, we are taking all the exposure we are prepared to accept in the daytime to go to work, to do the things that you do in the daytime. So 9 o'clock means that if you are out, depending on how far away you are from home, depending on the traffic you anticipate and so on, you have to start getting ready to be inside from 7 o'clock, including traveling home, including getting in and so on. So effectively, that 9 o'clock curfew begins to bring people away from other people after sunset. Now, some people are interpreting this in the worst possible way. Other governments, other prime ministers, other countries have had to do other things. There was a time in England, not too long ago, when you were told by the government not to have any visitors come into your house. And if they do come to visit you, you're allowed to meet one person on the pavement. And of course, as I said, right next door in Jamaica, they have no movement days. A series of no movement days published recently. So and so days, don't move. Meaning you can't come out as we are coming out in the daytime and being restricted in the nighttime. So our restriction, yes, it's inconvenient, but just remember, there is a purpose behind it. And if we don't do that because of all the kinds of explanation we're having and reasons to not do it, the alternative is to encourage a situation where the infection levels can go up and go up dramatically. Because I want to point out, when you look at Dr. Heinz's graph, see where we started in March and how that graph moved so steeply to June. And remember the reaction in this country on the day when we reported 25 deaths on one day. Now we are operating with this greater opening for good reason, to allow opportunities in livelihoods, but we are at a much higher plateau than we were in March. So if we start a runaway infection now, the outcome would be worse than it was in June. And that's all I'm saying. And that is the price we are paying. The staying in at night, that is the price we are paying to not end up in that situation. So for now, we will keep it. And as I said in the Parliament, and I've said before, at the first opportunity where we believe on the advice that we're getting and the data speaking to us, at the first opportunity we get, we will bring a removal of the restrictions. There's another group of people who love and can't wait to get to the beach. I might be one of them, I don't know. But the bottom line is, as soon as we are able to give you that relief, but let us not demand that relief now and pay the price of a reinfection level that we can't cope with. Right? I am happy with the report we got today, because Dr. Richards' report showed that our hospitals are not where they were at a time of great concern. They are of concern, but because we are there is why we have to keep it there. Let us not do anything to change that for the worse. Let's try and make that better. Okay?
I'm getting a lot of questions from readers about booster shots for immunocompromised people. Has there been any updates and considerations?
Yeah, so there's no change in terms of the WHO status as yet with regards to booster. As far as I know, the only type of vaccine that has applied to WHO is the Pfizer vaccine for a booster. They're asking for a third shot. So there's no change from the WHO side. So we continue to look at what is happening in terms of the world. There is general talk that a booster may be required as time progresses for even other types of vaccines beyond Pfizer based on the evidence before us. But again, we have to wait on and see what happens.
Specifically for the immunocompromised, and those are like
yeah, I think that's some of the data that has been provided to WHO to show for immunocompromised people who generally don't have as good as a response as you would expect for any vaccine. They are building that data set to go to them first.
I'm taking advantage of having more than 2 questions to ask, right? So in Dr. Trotman's speech, well, her contribution as well as a while ago with Dr. Richards, would have noticed that people who are coming into the parallel healthcare system seemingly more ill. They seemingly have some more severe illness. Isn't that a function of vaccination levels within the population, that it's just that there's less people with milder symptoms because of vaccination coming into the hospitals?
Well, I think that's an oversimplification a little bit of what is happening. I think it's more or less, it will vary based on the locality, the type of patient that is coming in. But generally speaking, the more severe cases will get to your A&Es. That has been the case throughout the epidemic. There was at some period where people were coming in to ensure that they got tested, knowing fully well that if you are a known positive, of course, you could get care at a facility, a COVID positive case. So there was preemptive increase in testing in that regard. But generally speaking, the cases that we have been having, and the more severe ones, are of the unvaccinated people. So we need to get to a space where we understand that, we get our vaccination, and of course the outcome will be better for all of us.
CMO, could you reiterate that of the deaths we are experiencing, have any of those been fully vaccinated?
So Dr. Hines would have, I think, and Dr. Trotman, a couple of weeks ago, right at the Prime Minister's press conference, we would have said we had one case of a person that was significantly immunocompromised at the time, and he had passed away with a fully vaccinated. Since June 8 to present, we have 668 deaths. Of those, we have 3 persons, all of which had severe, I would say, comorbidities, which would have been antecedent to some extent to the cause of death. But we have 3 fully vaccinated persons out of the 668, giving us a percent of 0.45% of all deaths that would have been vaccinated, meaning of the cases that would have died from June 8 to present, 668, 99.45% were unvaccinated, which is what the data tells us from across the world.
Okay, so if there are no more questions, thank you very much for coming. Thank you very much for participating, and we look forward to giving you good news as we vaccinate to operate, vaccinate to educate, and educate to vaccinate. Thank you all very much.